Vaginal cancer usually is one that don't start there. It's one that has spread from somewhere else to that area. Risk factors: HPV, as it is with a lot of gynecological cancers, uh, prior history of a malignancy, advanced age, so getting older, multiple partners in a lifetime, and early age at first intercourse, and this is another one of those that smoking is going to make a big difference. The average age at diagnosis is 60, and it tends to develop, or for some patients, it develops to daughters of mothers who had a medication called DES during their pregnancies. Now, a lot of that has now gone beyond the time frame where that's the case, but that is where it has been in the past primarily. Um, One of the most common symptoms is bleeding, um, and that a lot of times is a postmenopausal type bleeding when they shouldn't be having any at all. A foul smelling, watery discharge, uh, pain with urination, constipation, a lot of vaginal versus rectal type of problems. They may have a mass or a plaque-like area on the walls. Um, Diagnosis is determined by doing a colposcopy and looking at the cervix with a microscope, and then doing a biopsy. Treatment is based on mainly on the location, how large is it, and what stage is it. But usually, a hysterectomy is required. Sometimes removal of the vagina um, as well, or may also include removal of the lymph nodes in the pelvis, which is pretty radical surgery in this case, and then radiation may be another thing that is done along with the surgery. Prevention: regular pap smears, using barrier contraceptive devices, and limiting the number of sexual partners. Obviously, that is something that you can't do um, in reverse. So, beyond that is periodic follow ups looking for any sign or symptom. Labial or vulvar cancer, so this is more to the outside. More than 90% are squamous cell carcinomas as a tissue type. Um, it is risk factors are going to be smoking again, HPV, HIV infection, multiple partners, um, history of cervical cancer, and being of North European ancestry, which would also consider a good number of people. They'll start typically with a pap smear as far as diagnosis, and then go from that, looking at staging of the tumor through a biopsy and looking at the results, and looking at the lymph nodes and looking at whether or not it has metastasized or spread somewhere else. Treatment in these types of cancer is usually surgical removal uh, of the area of tissue entirely, um, which may mean total removal of the vulva. Radiation, chemotherapy, looking for advanced stage cancer, and looking for distant um, metastasis or recurrence from another site. Um, Risk of recurrence is fairly high. Um, but the overall 5-year survivor rate is 25% to over 90%, depending on the stage. So early stage is going to be close to that 90%. Later stage, metastatic stages are going to be more closer to that 25%. You know, ovarian cancer, those women who've had breast cancer, who have a family history of breast cancer or ovarian cancer, are at higher risk of developing ovarian cancer. Um, and there's even a cross connection between ovarian cancer and colon cancer. So um, there's some added potential risk factors we look at here. Um, this one causes more deaths than any other gynecological malignancy. So any other type of gynecology based cancers. Because the ovaries are located very deep within the pelvis. A lot of times there's not any symptoms until it is in a very advanced stage, which poses one of the big problems. Any female who's considered at higher risk needs to have regular gynecological examinations. Symptoms of ovarian cancer, enlargement of the abdomen, and this is because of fluid accumulation in the abdomen, lower abdominal discomfort, lower back pain. So some of these are a little bit almost vague. Irregular menstrual cycles, frequent urination, dyspareunia, um, vague digestive disturbance. So not a lot of symptoms here that would be targeting something like this that you would consider. Most ovarian cancers occur in women over the age of 40, so that is one of the key points. Because the ovaries are deep in the pelvic area, it's sometimes hard, even in a physical exam, to identify a mass there. Um, if there's not any significant suggestion of malignancy, then they'll typically follow them for a couple of months before they, to make sure it's not going to go away first. And staging it is based on uh, laparoscopy, biopsy, and those kind of things. Uh, So the pelvic ultrasound is one of the tools that they would use. There's a serum marker, CA-125, helps to determine the malignancy of or likelihood of the mass, and then doing abdominal pelvic CAT scans um, to look at the degree of spread of the cancer. If the cancer is diagnosed really early and the woman really still wants to have children, they may just remove the ovary that is involved specifically and leave the other one temporarily. And they'll follow them typically with exams and the CA-125 test. 5-year survival rate for ovarian cancer is about 50%. Um, Unfortunately, a lot of times it's spread beyond that early phase, in which case there's probably 75% of them um, are beyond that ovary at that time, so they're already spreading. Um, so they remove the ovaries, they remove the tubes, they remove the uterus. Um, it, Look at how advanced the stage of the cancer is, and then they're probably going to do some chemotherapy.